Jeremy, I also wanted to talk about extremely popular method of keeping the youth and preventing the aging face. It's Botox and Dysport. It's been more than 100 years since Botox was originally discovered. And from 1895, when it was originally introduced, the doctors were really fascinated how to use this product and in what situations. Till the end of 1968, when Botox was used for treating the spasm of the mimic muscles on the face and the treatment of temporomandibular joint disorders. And after that, Botox and its analog, Dysport, are extremely popular in facial cosmetics. So, Jeremy, can you please share with us what are your most common and ordinary and unordinary ways to use these products?
Okay, well, first of all, that was a very impressive historical review. So very good. Botox and Dysport, the current approval by the FDA is really just for treatment of the glabella area, which is this area on the forehead. But very commonly, so it actually helps to treat the muscles that are oftentimes overactive in the area and cause these wrinkles in our forehead. The idea is not necessarily to paralyze the entire forehead. The idea is to soften these wrinkles and allow for a more youthful, relaxed appearance. The downside to Botox and Dysport is that unfortunately it's not a permanent thing. It will only last about 3 to 4 months, and it takes a couple of days to take effect. The other areas where you can also use it, though, you can use it in the forehead to relax the brow muscles, and you can also use it around the crow's feet. Again, these are not the strict FDA approved usages, but they're very commonly used that way. There are lots of other techniques that people will use. They'll even use it to sometimes relax some of the muscles in the platysma in the neck or around the lip.
Especially with the vertical smoke lines.
Well, that's a little different. The smoke lines around the lip are usually treated with fillers because those are static lines. So you can actually fill in that space and help to rejuvenate the skin and restore the volume. A nice thing to do along with that, though, is if someone has a thin upper or lower lip, you can inject the lips themselves. The key thing here is to still maintain a nice natural appearance and not to end up with the typical duck bill that a lot of times we see out. And this is just based on different techniques that people use.
It also was popular for injections in the axilla to prevent the excess sweating. Especially it's pretty popular in Florida. And do you have any comments on like more ordinary use of Botox and Dysport?
Sure. Well, actually, the way that, like you were talking about before with TMJ problems, botulinum toxin, this is something that arose from as a toxin, as a problem from the bacterium. And this is one of the reasons why we don't allow little babies to eat honey, because of the fear that they're going to get botulism from that.
Another interesting topic that basically is very actual for any woman is an extra weight and the ways to lose this extra weight. And there are different approaches and there are different techniques besides our routine exercise and diet pills. And at certain stage, a lot of women just turn towards the plastic surgery. And there are invasive and non-invasive techniques. So, Jeremy, can you please share with us about invasive and non-invasive liposuction?
Sure. Well, Olga, I think you hit it on the spot. First off, definitely diet and exercise. You want to try and get to as close to your ideal weight as you can by yourself. Sometimes this requires the help of a nutritionist to help you start eating right and the help of an exercise program to really get you on the right track. Once you've gotten yourself down to, you've optimized everything else, and you're at a point where you just have those certain areas that you just can't lose, I think that's the time where you're a better candidate for surgery. Ways to approach those little areas are, one, you can use a non-invasive approach, which is something like Zeltiq. And what Zeltiq is a new technology. It freezes the fat, and you sit in a chair for about an hour, and you have this suction cup sitting on your, let's say, your love handles, and it freezes the fat. And over time, over a couple of weeks period, that fat undergoes what's called cryolipolysis, which just means that fat cells die. And about 20% of those fat cells will die over that 3-week period of time. Sorry, over the 3-month period of time. There's really minimal downtime to that, minimal problems with it. So it's a great technique really when you're looking for a small change, and it can be repeated. When you really want to treat an area to its fullness, that's when liposuction comes into play. And there are lots of different toys out there for liposuction. The traditional method of liposuction is using a cannula, using this hollow tube with a blunt end on it, and you make tiny incisions around the area, and you basically sculpt out the fat. Mm-hmm. And fortunately, this can also be used again at the same time if you wanted to put it where you do want it. Take it where you don't want it, and put it where you do want it, sometimes in the buttocks. There are other technologies that are out as well for liposuction that a lot of people ask me about. So one thing is ultrasonic and powered liposuction. Powered liposuction means that the cannula is moving itself. So the end of it, the little tip, is moving. And that really helps the surgeon, helps it make it easier for the surgeon to do the liposuction. It's a really great tool to use for male gynecomastia or male breasts. But it's not something that you always need. The other thing is with the ultrasound liposuction, again, it makes it easier to pass the cannula through in a more smooth process. But it doesn't necessarily enhance your result. The other big question that people ask about is laser liposuction, because there's a lot of there's a lot of publicity about it.
A lot of advertisement.
Right. And so really, does it make a difference? Honestly, according to the literature that I've seen, it's a controversial topic. And a lot of times there's really no evidence that shows that there's much of an additional benefit. A lot of people will say that it causes extra skin tightening, and it may, but it's oftentimes very difficult to notice this, and that would not be the reason why I would choose laser liposuction over anything else. And the other thing you have to consider is that there's added risk in doing laser liposuction, and that is in terms of burns. And we've seen these types of things coming in from other practices, during my training, and it's a difficult thing to take care of. So I like to kind of focus on techniques and technologies that are safe and can still
give more predictable results.
Right, exactly.
Okay, thank you. And also in Miami, the new trend that appeared in a couple of years is the enhancing the buttocks. And this trend is becoming more and more popular with every year. And also probably because with dominating mass media, the certain image of the female body is actually posted everywhere in journals and in TV, in commercials, and more women are interested in this type of treatment. So if you can please tell us about the buttock surgery.
Sure.
Or Brazilian butt lift.
The Brazilian butt lift. Okay, well the Brazilian butt lift it's a great term. I wish I'd coined it myself. Basically what it is though is what we were talking about before, taking fat from where you don't want it and putting it where you do want it. And so oftentimes women want to enhance the curvature of the buttocks, and oftentimes that includes also sculpting out the lower back area so that they have a nice smooth contour. And what that involves is basically it's a fat injection into the backside. They really just have to protect the area over time, over a couple of weeks, and wear a garment. But overall, patients tend to do pretty well. One thing about fat injections into the buttocks, and really just as same as in any other area, is that you often have to over-inject the area in order to get the results that you want. So sometimes you may even have to repeat the procedure down the line, because what happens is sometimes not all the fat takes. In fact, we know that not all the fat takes, only a certain percentage. And that varies upon the area. The other option is you can take an implant and put it in the buttocks. This does carry a risk though, because you are putting a foreign body in a place where you're sitting every day. So there is a potential that the implant can extrude, and so it's a little bit of a higher risk in terms of that for surgery. Third option is something that I like to do also, which is taking part of the tissue when you've done a tummy tuck and you've come around the backside, and you've done a posterior lift, posterior body lift. And instead of throwing away all that tissue, why don't we use that tissue? So you can actually take off the skin and use it as a flap and place it into the buttock. And there may be a higher rate of take from that particular area of fat, where you can control it and place it into the buttocks. So 3 different ways for 3 different types of people.
That's very interesting approach. I never heard about this third option. And also, when you make the tummy tuck or mommy makeover, you also address the breasts as well.
Sure.
Because probably after multiple pregnancies, or even after one pregnancy and breastfeeding, a lot of women get sagging of the breasts. So this also can be addressed during mommy makeover.
Right. Absolutely. It's like you said. It's one of those things that really makes women happy. What happens over time after you breastfeed, during breastfeeding, the breasts get engorged and they enlarge, but unfortunately once it's all done, they lose all that volume, or a lot of that volume, and after a bunch of kids in particular, it's harder for the body to bounce back. Some women are very lucky and they get to keep it all, but some others are not as fortunate. So there are 2 ways to address that. One is with implants, and the other is with a mastopexy or breast lift. If there's only a small amount of drooping or ptosis, then sometimes you can address the drooping with an implant alone, unless you're completely opposed to having an implant, in which again you can just use a mastopexy, which is different types of scars that can be placed on the breast to redrape the skin and tighten the skin around the breast and support it. This can come either as a periareolar, meaning a circle around the breast, or a circle around the nipple, or almost like a lollipop scar where it has a vertical component, and sometimes even requires an anchor component below the breast if it's really significant drooping. But oftentimes, for more significant drooping, it requires a combination between an implant to restore the projection of the breast and volume, and a mastopexy to bring the lift.
Also, I wanted to ask you about the most popular procedure everywhere in the world. It's breast augmentation. And everybody all my patients, my friends, ask me about difference between the saline and silicone implants. Should they do the procedure or not? And this is a very hard subject for every plastic surgeon and for every woman, and especially living in Florida, where the body almost all the time is exposed, and we have, thanks God, a good climate here. I think it makes this procedure even more popular. So you do breast augmentation, and what you would say to our patients?
Sure. Well, breast augmentation it's a great surgery. It's not for everybody, and it is sort of a lifelong decision. So when someone wants to enhance, let's say you have a girl in their 20s and they want to enhance the projection and the volume of their breasts, breast augmentation is a great option. But you have to consider that you are putting an implant in your body, and this is something that you would have to deal with the rest of your life. Makes many women very happy though. There are two options. There's the saline implant, which is salt water, and that you have salt water all over your body. And then there's the silicone implant, which is back on the market after significant trials with the FDA to get it back on the market to prove that there's no extra risk of cancer having these silicone implants, which is great because these silicone implants are much more natural looking and feel much more natural. Once you've decided that you want to get breast augmentation, there are multiple different approaches how to put it in. So this can be done through multiple different incisions. One is around the nipple, just underneath the nipple. One is underneath the breast, which is, both of them are very well hidden. They allow you to really control the placement of the implant very nicely. And then you can also go through the armpit. The downside of that is, as you can imagine, you're starting out a little further away from the actual breast. So sometimes it's a little harder to control the placement of the implant in a very precise pocket, which is really the key. Some people will go through the belly button as well, which is an amazing idea. The downside to that is, one, you can only use saltwater implants because there's no way that you can fit a silicone implant up these tubes that they put. Basically what they do is you make an incision in the belly button and you place a tube, bluntly, up through the tummy, underneath the skin, just underneath the skin, and then you get into underneath the breast tissue, and then you bluntly dissect the pocket, and then you thread up the implant and you fill it up. There's no way you can get a silicone implant in there. And the other thing is, it's because, again, just like with the axilla in the armpit, it's harder to control the actual precise pocket placement, and that is really the key to the best long-term result. Okay? Now I mentioned before that breast implants are a lifelong decision, and that's because even though most women are very happy with them, over time there can be problems with them. Okay?
Like what type of problems?
Well, implants can rupture, okay, which would necessitate or need you to get them removed. Implants can also develop what's called capsular contracture, which means that your body walls it off because it knows this is not part of your body. So your body walls off the implant from its own tissues. And sometimes that can get really hard. So if you ever see people on the beach with these very round breasts, almost tight balls, that's capsular contracture. Very common, treatable. But it's certainly a problem that can occur down the line. The nice thing is that we have newer implants on the market, and the implants keep getting better and better. And our capsular contracture rates are getting better and better along with them. So what used to be more along the lines for cosmetic, between 5 and 10%, now we're talking 2 to 5% in a lot of the longer term studies of the newer silicone implants. There's also a new implant out there by a company called Sientra, and they're making anatomic implants, and what that is, they're teardrop shaped. So they sort of replicate the natural appearance of the breast, and they're great for certain patients. It can really make a huge difference. Certain body types, if you have a very wide or very tall torso, these can really be tailored to the person rather than giving everyone a round-shaped implant. So it makes sense.
Yes.
But again, every implant has its own nuances and potential problems associated with them.
Yes. Thank you very much. Dr. White, thank you for being with us today. And if you have any questions, you can contact Dr. White on the phone or the email. Thank you.
Thank you for having me.